On Monday, the global death toll from the coronavirus pandemic reached 5 million. That's according to Johns Hopkins University. The figure serves as a stark reminder there's still a long way to go before things return to normal. More than 3.8 billion people have now received at least one dose of the vaccine. That's more than half the global population, but the numbers are less encouraging if we look at vaccine distribution. While wealthier countries, including the UAE and Singapore, boast inoculation rates of more than 80%, 6 countries at the bottom of the chart have less than 1% of their populations vaccinated. We're going to take a closer look at the story now with Dr. Bharat Pankania. He's a senior clinical lecturer at the University of Exeter Medical School, joining us from Bath. Doctor, always good to speak to you and get your take on this. Now, that figure of 5 million certainly seems high, but the World Health Organization says the figure is most likely 3 times higher than that.
And I would be inclined to very much agree with the WHO statement that this figure, whilst it is officially recorded by the Johns Hopkins University, United States, the real figure will be much higher. And then the other thing that we also need to be aware of is that people died of heart disease, strokes, etc., due to a delay because the hospital could not treat them because they were busy treating COVID. And those figures should also be accounted for as a consequence of COVID. They didn't die of COVID, but consequences of COVID led to their early death from an untreated cancer, heart disease, and other things.
And of course, that was the knock-on effect from this pandemic, a knock-on effect we're still actually feeling to this day. However, are we going to see, do you think, a reduction in those mortality rates as we see more people getting vaccinated? Because the truth of the matter is that people aren't going to stop dying from COVID-19, but we do need to get vaccination rates up.
Unfortunately, it will be a slow process, but without a doubt, we have demonstrated in the Western nations that vaccines prevent you from getting severe illness and death. And therefore, once we finally manage to get Africa, South America, and parts of Asia fully immunized, we will find deaths go, and what we have is the uncoupling. We have the cases, but we don't have the deaths because they are protected by the vaccines.
And Doctor, the head of the WHO, Dr. Tedros, has said the vaccine doses, had they been distributed fairly, and I'm quoting him here, we would have reached our 40% target in every country by now. But this would never have been the case in the first place because there was so much talk from world leaders about global equality and getting vaccines to everyone in the world. But when it all came down to it, everyone scooped up those vaccines for themselves.
Indeed, and there is a lot of vaccine nationalism by the richer nations of the European Union, United Kingdom, and United States. Extremely unfortunate. We need to immunize the rest of the world, and we need to make the vaccine manufacture possible in other parts of the world. Otherwise, we will continue to see people die over there, and also variants of concern arising from countries where there is runaway infections.
It does seem like we're still a long way off from really getting this pandemic under control. Dr. Bharat Pankania speaking to us there from Bath. Thank you so much for your insight.